they are limited to 5 minutes of questioning. Again, as I stated before, we're going to adhere by that today. Per committee custom, the witness will have the opportunity for a 5-minute opening statement, followed by...
We are today the sickest country in the world. We have the highest death rate during COVID of any nation on earth. And that's because of our chronic disease epidemic. That's because we had the highest chronic disease burden of any country in the world. Throwing money at this agency has not worked. We need to realign the agency. We need to recalibrate its trajectory so that it transforms our healthcare system from a sick care system into a healthcare system. NIH should be telling us what are seed oils doing to our children? What is corn syrup doing to our children? What are food dyes doing to our children? What is the packaging and microplastics doing to our children? What are pesticides doing to our children? None of those studies were being done. The studies that were being done by NIH and many, let me give you an example of the few that I cut. There was a study, a $2.2 million study from Boston University to study the effects of exogenous testosterone therapy on communication in gender-diverse speakers. We got a $3 million study at the University of Pennsylvania that studied anti-vaping social media campaigns targeted towards sexual gender minorities, teens between 13 and 18. We got $1 million from the University of Michigan to study sexual fluidity and longitudinal changes in alcohol misuse.
The chair now recognizes the gentlelady from Washington State, Dr. Schreier, for 5 minutes of questioning.
Now, I know Senator Cassidy had concerns about your views on this, and so when he voted to confirm you as Secretary of HHS on February 4th, he explained that decision by saying on the Senate floor that, quote, if confirmed, you will maintain the CDC's Advisory Committee on Immunization Practices without changes. But then 2 weeks ago, you fired all 17 experts on that very committee. Mr. Secretary, question for you. Did you lie to Senator Cassidy when you told him you would not change this panel of experts?
I never made that agreement.
So are you saying that Senator Cassidy lied when he was on the Senate floor, lied to the American people?
I didn't see that statement by Senator Cassidy. I've only heard it from you, but if he said that I agreed to it, it would be inaccurate. I made an agreement with him. I made an agreement with him, and he and I have talked many times about that agreement.
My time. I just want to tell you that for most of us sitting here right now, we believe Senator Cassidy more than we trust you when it comes to vaccinations. It sounds to me like you gave him the answer he needed to hear in order to get his confirmation vote. And then as soon as you were secretary, you turned around and did whatever you want. You fired all 17 members.
I'm complying with all the agreements that I made
Mr.
with
Secretary,
Senator Cassidy.
You're now on the record. You lied to Senator Cassidy. You have lied to the American people. You have lied to parents about vaccines for 20 years. And I also want to be clear that I will lay all responsibility for every death from a vaccine-preventable illness at your feet. I yield back.
The gentlelady yields. The chair now recognizes the gentleman.
What do you see HHS becoming if the injunction lifted with the reduction in force in place?
The people who are subject to the injunction force are on administrative leave, and they will remain on administrative leave until the injunction is lifted. At that point, we will make decisions, and in some cases, there have been gaps in our ability to perform our duties. I've brought people back. I've brought 722 people back to CDC. I brought 220 people back to NIH because we were not able to perform our job. And I brought 313 people back to NIOSH for the World Trade Center, for the Cleveland office and the Morgantown office. They were doing important work that we did not, that was critical.
Representative Pallone for 5 minutes of questioning.
Thank you, Mr. Chairman. Secretary Kennedy, Mr. Secretary, the science is not on your side. I just really think that people are going to die as a result of your actions and congressional Republicans' actions.
It's actually not our first time meeting. We met a very, very long time ago when I was 9 years old. Why did you nearly double the rate that taxpayer dollars give for-profit insurance companies like United next year, if you don't know those things?
Double the rate? How did I do that?
So your agency nearly doubled the taxpayer dollars that for-profit insurance corporations like United will be paid next year, meaning these companies, the largest of whom is under investigation, criminal investigation by the Trump administration, will be receiving an additional $25 billion from your agency.
How is that happening?
I would be happy to submit to the congressional record evidence of this.
Order for 5 minutes of questioning.
Thank you, Mr. Chairman. Secretary Kennedy, I want to ask you about, I'd like to bring your attention termination of HIV vaccine studies. These cuts make up $258 million. Secretary Kennedy, did you make the decision to terminate these studies?
I didn't personally make that decision, but I understand.
You sanctioned them. How could you possibly justify such an action?
We've been studying been promising an HIV vaccine since 1984. And every year Congress pours money into it, and every year
because they haven't come up with
every year
one,
it
you then
accomplishes
cut the
nothing.
forward motion by getting rid of NIH dollars that critically do research that save lives, and because it hasn't happened yet, well, we haven't.
me
Sir,
one
sir, it's
life.
my time. It's my time. So,
Show me
sir,
one
it's
life.
my time, sir.
Show me one
I
life.
can show you a whole lot of lives if you got a minute. I'm insulted that you would suggest that there aren't lives that have been lost. People are dying every day, sir. And for you to say, show me one, there are people all over this country that are suffering the loss of their loved ones.
First, I'd just like to offer you a moment to respond to the outlandish claims that were put in front of you just now.
Yeah, as I said, we've got 27 HIV divisions. Some of those were cut. Some of the studies that were not, where we poured billions of dollars in and they were yielding nothing, have been cut. We're looking for a real solution. And we're looking to do evidence-based, gold standard science.